If you are turning 65 this year or in the next few months, this is the most important Medicare video you will ever watch. Medicare is not automatic, it is not free, and the decisions you make right now will follow you for the rest of your life. Today, I am going to walk you through everything you need to know step by step so you can make the smartest Medicare decision possible. My name is Antonio Espino, founder of Espino Insurance Group. I am a licensed Medicare insurance agent, serving families across Brownsville, Harlingen, McAllen, and the entire Rio Grande Valley in South Texas, specializing in health insurance, life insurance, and annuities. I help people turning 65 navigate Medicare every single day, and today I am going to share everything I tell my own clients in their very first appointment. Let us get started. The very first thing I want you to know, and this surprises a lot of people, Medicare is not automatic for everyone. If you are already receiving Social Security benefits before you turn 65, you will be enrolled in Medicare Parts A and B automatically. But if you are not yet receiving Social Security, for example, if you are still working, you need to sign up yourself. If you miss your window to enroll, you could face late enrollment penalties that follow you for life. So do not assume Medicare will just show up in your mailbox. So when exactly can you sign up? You have what is called Initial Enrollment Period, a 7-month window to enroll in Medicare. This window opens 3 months before the month you turn 65, includes the month of your birthday, and then closes 3 months after your birthday month. That is your 7-month window. My strong recommendation, do not wait until the last minute. Sign up in the 3 months before your birthday month so your coverage starts on time and you avoid any gap. Now, let us walk through each part of Medicare so you know exactly what you are getting. Let us start with Part A, which is your hospital insurance. Part A covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health services. Here's the great news for most people. Part A is completely free. If you or your spouse worked at least 10 years, that is 40 quarters, and paid Medicare taxes, you qualify for premium-free Part A. In 2026, the Part A deductible is $1,736 per benefit period, not per year. That is an important distinction. Part B is your medical insurance, and this is where most people start paying a monthly premium. Part B covers doctor visits, outpatient care, preventive services, lab tests, and medical equipment. In 2026, the standard Part B premium is $202.90 per month. The annual Part B deductible is $283. After that, Medicare typically pays 80% of approved costs and you pay 20%. That 20% with no cap is actually one of the biggest financial risks in original Medicare, and it is why most people add additional coverage on top of Parts A and B. Part C is Medicare Advantage, and this is one of the most popular options for people turning 65. Medicare Advantage plans are offered by private insurance companies approved by Medicare. They combine your Part A, Part B, and usually Part D drug coverage all in one plan. Many Medicare Advantage plans have $0 premiums, meaning you just pay your Part B premium of $202.90 a month and nothing more for the plan itself. Most plans also include extra benefits like dental, vision, hearing, and fitness programs. However, Medicare Advantage plans use networks of doctors and hospitals, so it is important to make sure your preferred doctors are in the plan's network before you enroll. Part D is your prescription drug coverage. If you choose original Medicare Parts A and B, you will need to add a standalone Part D drug plan separately. If you enroll in Medicare Advantage, drug coverage is usually already included. Here's something very important. Even if you do not take any medications right now, I strongly recommend enrolling in Part D. Why? Because if you go without credible drug coverage for 63 days or more and then later decide you want it, you will face a late enrollment penalty for as long as you have Part D. In 2026, the maximum Part D deductible is $615, and the out-of-pocket cap for drugs is $2,100. Now let me tell you about another option that many people turning 65 consider: Medicare Supplement plans, also called Medigap. These plans work alongside original Medicare Parts A and B and help pay for the costs that Medicare does not cover, like your deductibles, coinsurance, and copays. The biggest advantage of a Medicare Supplement plan is freedom. You can see any doctor in the country who accepts Medicare with no network restrictions at all. The most popular plan is Plan G, which covers nearly all your out-of-pocket costs after the Part B deductible. The trade-off is that Medigap plans have a monthly premium in addition to your Part B premium, but for people who see doctors frequently, it can be the best option. So, which is better, Medicare Advantage or Medicare Supplement? Honestly, it depends entirely on your personal situation. Medicare Advantage works well for healthy people wanting extra benefits. Supplement works for those wanting predictable costs and freedom of choice. There's no one-size-fits-all answer, which is exactly why I sit down with every single client individually to review their specific health needs and budget. Now, I want to talk about something that I see hurt people financially more than almost anything else: the late enrollment penalties. If you do not sign up for Part B when you are first eligible, you will pay a 10% penalty on your premium for every 12-month period, and that penalty lasts for life. Part D has a similar penalty, 1% for every month you go without credible drug coverage. These penalties are completely avoidable, but only if you act on time. Here is something that surprises almost every person turning 65. There are some very important things Medicare does not cover. Original Medicare does not cover routine dental, vision exams, eyeglasses, hearing aids, or most long-term nursing home care. And it does not cover care outside the US. These gaps are real and expensive. This is why looking at Medicare Advantage plans with dental and vision benefits is such an important part of your planning. Here is something I want every person turning 65 in South Texas to know: there are programs that can pay your Part B premium for you. In 2026 here in Texas, if your monthly income is at or below $1,325 as an individual, you may qualify for the QMB program. If your income is a little higher, you may still qualify for SLMB or QI, which pay your Part B premium. Do not assume you do not qualify without checking. So let me give you your Medicare Action Checklist. Step 1, find out if you need to enroll manually. Step 2, mark your calendar for your initial enrollment period. Step 3, gather your list of doctors. Step 4, decide between Advantage and Supplement. Step 5, make sure you have Part D. Step 6, check for savings programs. And Step 7, call a licensed Medicare advisor who can walk you through all of this for free. Before I wrap up, let me share the 3 biggest mistakes I see people make when they turn 65. Mistake 1, waiting too long and getting a penalty. Mistake 2, picking a plan without checking your doctors. Mistake 3, assuming everything is covered and getting a surprise bill. All 3 of these mistakes are completely avoidable with the right guidance, and that is exactly what I am here for. Here in the Rio Grande Valley, in Brownsville, Harlingen, McAllen, and all across South Texas, I work with families every week who feel overwhelmed. You are not alone. This is confusing, and that is exactly why I do what I do. At Espino Insurance Group, I explain every option in plain English or in Spanish. If you are turning 65 and you want someone to walk you through your Medicare options, personally call or text me directly at 956455113, or click the link below to schedule your free Medicare review appointment today. I will review your doctors, your medications, and your budget for free. There is no pressure, no obligation, and absolutely no cost. I am Antonio Espino with Espino Insurance Group, and I am here to make sure you start Medicare the right way.